Welcome to this video series on adolescent drug and alcohol use. Today, Dr. Jenny James and my focus is on young people aged between 14 and 17 years and how you as a GP can engage them in discussion on the top 3 drugs used by the age group: alcohol, tobacco and cannabis. We'll be using the 5 A's framework from the RACGP SNAP Guide on preventative care to structure our consultation. Now, the SNAP Guide refers to smoking, nutrition, alcohol and physical activity, and today we're expanding that out to include cannabis. The 5 A's are asking, assessing, advising, assisting and arranging. Now, for many of you, you may be aware of these, but for others you're wondering, well, what are these 5 A's? And in actual fact, they're what we do every day in consultations. So asking is asking the question, screening and asking permission to ask. Assessing is doing a comprehensive assessment of what's going on for the young person. Advising is giving support and information. Assisting is treatment and management options. And arranging is either following up care yourself or looking at referral options or other supports that are out there for your patient. It is vital that GPs engage with young people and talk about alcohol and other drugs because we are the most accessible primary healthcare provider for young people. We see them the most. You are often the first point of contact with the health system for young people, and you can help prevent future harmful use. There are known harms associated with all levels of use. And the earlier the onset of alcohol and other drug use, the more likely a young person is to experience harms from such use in the future. The engagement and process skills that you will learn in this series can be used with all young people you see using alcohol and other drugs.
Experimenting with alcohol and other drugs is a relatively normal part of adolescent risk-taking behaviour. However, GPs should be alert to substance use and its impact on the developing brain. Many young people's AOD use is limited to their adolescence rather than their entire life, but some young people may develop chronic drug use and frequent harmful binge patterns. Effective communication is vital when engaging with young people. When talking with a young person, remember to assess the young person's competency, especially when they're under the age of 16. Be non-judgmental and avoid using stigmatising language. Help them identify the negative outcomes of continuing certain behaviours and relate these behaviours to their immediate concerns. For example, are they concerned about the effects on their appearance or are they concerned about their relationships? Be careful not to make assumptions about behaviours based on a young person's cultural or religious background. Remember, if they stop talking in the consult or appear disengaged, respect that. Young people need to develop trust with you before they will open up. Invite them back. Make sure your door is open for them to see you again. We're now going to hear an example using the first A, asking. We'll highlight some consultation skills at the beginning, but you should reflect throughout on what you think the GP does well and how you could integrate these skills into your consultations.
Hi doctor, I've brought Becky in today about her acne. She's been on a number of different treatments but they're still not working.
Sure, and we'll definitely address the acne. Whenever I see a young person, I like to spend some of the consult time talking directly with them. It's a chance for them to chat with me and ask any questions. I think it helps young people learn to feel confident communicating with health professionals and take responsibility for their own health. Would it be okay with you both if I saw Becky on her own for a few minutes?
Yeah, that's okay.
Okay, I'll wait for you guys in the waiting room.
Thanks, Becky. I wanted to talk with you today to get a better picture of your overall health by asking you about lifestyle issues, including alcohol and other drugs. These are questions that I ask all my patients, including young people. And what you tell me will be kept confidential. I won't tell your parents or anyone else without your permission. The only time I'd break confidentiality is if I'm seriously concerned about your welfare and well-being or anyone else's. Then I have a duty to keep you and others safe. Is that okay with you?
Sure, it's okay.
And you don't have to answer any questions you don't want to either. That's fine.
Okay, thanks.
So, Becky, you're 15 now, and I'm guessing people in your class drink alcohol sometimes, maybe at parties. Do you drink alcohol?
Yeah, I have, but not anything else.
Sure. Would you mind if we had a chat about what you like to drink and how to best protect your health?
Yeah, that's okay.
You'll notice that in this example, the focus isn't on immediately trying to stop Becky from drinking, but on engaging her and seeking permission to begin a conversation about her alcohol use. We know that Becky is consuming alcohol, but this could be only one aspect of her AOD use. When assessing and advising a patient, it's important to have a holistic understanding of what they are consuming. A general AOD assessment will cover a number of issues. What drug is the young person using? How often do they use the substance? How much of the substance do they use? What's their method of use? What are the patterns of use? What's the context of use of the substance? What are the effects of the substance use? How does the young person obtain and pay for the substance? Have there been any harms from the use of the substance? What's the outcome of previous attempts to stop use? And finally, what does the young person want to do about their substance use? Remember to tailor your AOD assessment to the young person before you. You can use AOD assessment tools such as the Audit C questionnaire and the SNAP guide to assessing alcohol use, or the SNAP guide to assessing smoking, the severity of dependence scale for cannabis, or the QDIT-R. If your patient is under 18, maybe use the HEADS assessment. It takes a holistic approach with young people and can help with gaining their trust, engaging them in treatment, and the HEADS assessment can be a therapeutic intervention in and of itself. It covers each of the items you can see on your screen. As a GP, taking a patient's history is a familiar skill to all of us. The question then becomes, what do you want to do with the answers? If your patient is using alcohol or other drugs, a brief intervention might be the next step.
Brief interventions are incredibly useful because they can be conducted by us within a usual consultation. They include screening and assessment, as well as information and advice that can help young people reduce or stop their risky use. A good brief intervention will provide information and education. It will help a young person understand how their use may be affecting them and assist them to develop SMART goals that are specific, measurable, achievable, realistic and timely. For example, helping them to reduce their cannabis use by trying to have 4 cannabis-free days per week. Brief intervention always takes into account the age, emotional maturity, level of understanding, culture, faith and beliefs of a young person. It encourages the young person to consider involving their parents, carers and other responsible adults if at all possible. The most important thing to remember is that a brief intervention is person-centred. Relate the intervention back to the young person's own concerns. Here is an example of a brief intervention with Becky, having learned she drinks alcohol with her friends.
Thanks, Becky. So far you've told me about your alcohol use at parties and that when you have too much to drink, say around 5 or 6 drinks, you have arguments with your friends and that you wish you didn't. Would you be open to us bringing your mum into our conversation? If not, we can just keep talking ourselves. It's completely up to you.
Yeah, no, I don't really want Mum to know.
That's fine. I appreciate you talking to me about it. Would you like to discuss ways you can be more in control of the amount you drink at parties? This might mean that you drink less and that'd be good for your health. Can I give you some tips on how to drink less at parties with your friends and tell you about some websites for you to have a look at?
Yeah, okay, that sounds good.
A good thing to do that really helps keep track of how many drinks you have is only pouring them yourself and to set a limit on how many you will have at that night ahead of time. What limit do you think we could set together today?
Well, if I'm having cruises, how about 3? And I can do the same for vodka too.
That sounds like a good place to start, and that's about a half of what you've been drinking. Do you think you could pop a note in your phone so we can keep track of your progress and see what's working and what might not be working for you?
Yeah, I can do that. I can let you know how it's going.
Great. And I can think of a few websites that can tell you more about the effects of alcohol, and there's a very good one called Your Room that's been made for people around your age. So when you have a look at it, feel free to write down any questions you might have and you can bring them back to our next consult.
A 2018 Cochrane review found that there is evidence that brief interventions in the primary care setting can reduce alcohol consumption when compared to minimal or no intervention. Where a young person is ambivalent about reducing their use, motivational interviewing is a fantastic technique to continue the conversation. In the next video, we will explain the basics of motivational interviewing and give you another opportunity to review a consultation scenario.